So hello and welcome back to our final session today at our Ontario Network of CAPC and CPNP Projects 2023 online conference. And we're wrapping up our time together today with a town hall. And we are going to be looking at some information from a project that we've been engaged in called CAPC CPNP. It's right there on the screen, Projects Reflecting Together, Promising Adaptations and Future Directions Towards Equity, Diversity, and Inclusion. And to guide us in our conversation and to share information from this project, we have with us Janna Martin, who works for the Center for Community-Based Research. And she's a community-based researcher with 5 years of experience working across sectors in program evaluation, applied research, facilitation, and training. And we sure have been enjoying working with Janna on this project over the last year and are excited to have her here this afternoon to share some results and have conversation with us. So Janna, over to you.
Thank you so much, Sydney. I'm Janna, and as Sydney mentioned, I'm a researcher. I live in Guelph, Ontario, and I'm excited to be presenting at this conference session on the very recent research project with the title on the screen there. This one-year project began in April 2022 in collaboration with the Ontario Network. It was funded in part by the Evaluation Capacity Network SERI grant, and a steering committee of 7 CAPC CPNP project staff and network staff guided the research to ensure relevancy and action. Today, I will share the research findings, then we'll have small group discussions to hear your reactions and thoughts on the findings. And finally, we'll come back into the large group to hear summaries across groups. With that in mind as an agenda, I will jump right in. Just a little background on this research study you might be curious to know. Our main research questions were about shifting communities. In what ways has the diversity in local communities around CAPC CPNP been changing, and what needs are shifting as a result? The second question was around adapting programming. What innovative ways have programs adapted to respond to the shifting diversity and needs? And the final question was around determining strategic directions. What are the implications of all the answers we hear in the research for creating more equitable and inclusive CAPC CPNP programming in Ontario? To try to answer these questions, we engaged in a variety of different methods and ways of collecting data. So these were mostly engaging with CAPC CPNP staff across Ontario. The first method we did was a focus group. We conducted 3 focus groups, one with Indigenous projects across Ontario, one with rural projects, and one with urban projects. So we had 14 focus group participants in this first round. Then we had a discussion board, which was an online tool for folks to put their comments on the research questions. And we had 14 people posting online. Then we had a survey that was sent across the CAPC CPNP network, and 49 people filled out this survey as a team reflection tool on equity, diversity, and inclusion. Then we had key informant interviews. We wanted to get a perspective outside of the CAPC CPNP Ontario network, and we asked some questions of experts in the EDI and early childhood prenatal sector. And finally, we're gathering here today, and you are going to be part of this research study, because soon we'll have discussions about the findings and hear your inputs on this research. So everyone here today might be considered a research participant as well in this study. To provide some context, I thought I would give some brief definitions on equity, diversity, and inclusion, because we use this term a lot, as well as this acronym EDI. What I mean by equity is promoting fair treatment, access, opportunity, and advancement for all by identifying and eliminating barriers that prevent participation and access of some groups. By diversity, we mean differences in lived experiences and perspectives of people that may include race, color, place of origin, religion, immigrant, newcomer status, ability, gender identity, sexual orientation, and age, among others. Inclusion is authentically bringing traditionally excluded individuals and groups into processes, activities, and decision-making in a way that shares power. So this is what we mean by the term EDI. Another term we use quite frequently is equity deserving groups. And by that, we mean those who have faced collective barriers due to attitudinal, historic, social, and environmental disadvantage and discrimination. So I hope that provides some clarity moving forward. And I would like to ask a question of the group that we have here today. I'm curious to hear, what do you see as the strengths of CAPC CPNP projects to practice and promote equity, diversity, and inclusion? You might take a moment to think about this. You can type your answer perhaps in the chat, or you could raise your hand or unmute yourself. Kind of popcorn style answers to this question. I do see some things coming in the chat perhaps. So that's from Sydney. You can give a very practical example within your program, for example. All right, Jen said type of language used on websites, promotional material. So it sounds like inclusive language, perhaps. Thinking outside of the box, being flexible, being non-judgmental, that's a good one. Providing interpreters at groups. I'm guessing this language interpretation. That's great. Anyone else? Flexibility in funding to allow programs to determine priority for the community. Transportation to programming, incorporating traditions and cultures into groups. These are all really fantastic examples. Willingness to learn how to better serve. Absolutely. Incorporating client food suggestions into groups. Having resources in multiple languages. I'm loving these. Providing childcare at groups. Yeah, thank you so much for participating in the chat there. I think soon enough we'll see how your responses really relate to the research findings. So if it's all right, I'll move on to the next item. I'm going to now give a very brief outline summary of the research findings, and then this will help to ground us in our discussion coming up after this. So I'd like to begin with talking about strengths. I think many of the strengths that you provided in the chat were also themes within the research. One of the strongest themes within the research around strengths is that CAPC CPNP programs are embedded in community and able to shift and respond to changing needs. Because CAPC CPNP has been around for 25+ years, and their embeddedness into the words of a focus group participant, the fabric within our communities, which I think is a very beautiful metaphor, equips them with insights into their community's shifting needs. Research participants reported that projects have an ear for shifting needs, another great metaphor from a participant. And this is because they are flexible and continually assess the needs of current program participants. Another person explained a CAPC or CPNP site is not the same as the CPNP site across town. We're so unique and diverse. And so a conclusion that I made from this theme is that it appears that the embeddedness of CAPC CPNP programs and their ability to be flexible and responsive fosters trusting relationships with program participants, which leads to more honest feedback about programming, making it easier to adapt programming based on these relationships. A second theme that we heard, mostly from Indigenous participants in the focus group, is that CAPC CPNP provides a holistic approach, which is a strength for EDI. When a family crisis or environmental crisis happens, it affects the child who is from 0 to 6. And through partnership or through flexible programming, they're able to offer holistic support to families who are struggling the most. One way of offering holistic support that the Indigenous focus group participants talked about is that with families with young children, especially Indigenous families, to support them through advocacy efforts, such as a staff who successfully advocated to CAS to return an Indigenous child to their family, which was important for considering an advocacy lens to problems that the community is facing. A third theme here is that the network helped projects adapt during the pandemic, and they facilitate ongoing learning between projects. For example, focus group participants explained the network programming built capacity for projects to use new technology during the pandemic, and they engage people across Ontario to have meaningful discussions to identify changing needs and adaptations. So these were the key strengths for practicing EDI that were identified in the research. Keeping in mind those strengths for practicing EDI, there are also areas for growth that we identified. When asked to describe diversity in their geographical community and projects, CAPC CPNP staff often described diverse needs, and only some considered diverse identities. In a conversation with the steering committee, I learned that because projects are funded to serve people with specific needs, low economic status, social isolation, and other conditions of risk, for example, diverse identities might not be top of mind. For example, public health doesn't ask if projects are serving Black people or gender diverse people in their communities. Since equity deserving groups are becoming increasingly present in both rural and urban communities, an important EDI practice is to ask, who are projects reaching and why might they not be reaching people of certain identities? In a survey question listing equity deserving groups, CAPC CPNP staff especially noticed newcomers, gender diverse people, people with English as a second language, and economically disadvantaged people in rural communities as increasing groups within their geographical community. The second part to this research question is about shifting needs. Many factors such as shifting diversity and the global pandemic created new needs that CAPC CPNP projects have responded to. Research participants reported that more families are in need in their communities, and there are more complex, interrelated needs such as homelessness, food insecurity, addictions, and mental health. This has created new issues in service delivery, such as long wait lists, limited resources, and questions of how to prioritize needs. Research participants from rural areas noted that people moving in from the city to rural areas face a higher cost of living than anticipated and have challenges surviving in rural areas. Also, participants moving away from city centers due to heightened cost of living make services and supports more difficult to access. These are the main themes within the shifting communities question. To move us from research question 1 to research question 2 about adapting programming, I'd like to highlight to what extent CAPC CPNP projects report they are reaching various equity deserving groups. The 49 survey respondents reported that the equity deserving groups they are reaching the most, and you can see that on the graph, is economically disadvantaged people, people with English as a second language, and newcomers. The groups they are reaching the least are minority religious communities, people of diverse sexual orientations, and gender diverse people. If you're curious about how this was calculated, we basically gave a number value to the scale, with 0 being not at all and 3 being a great extent. And then we averaged out each of these numbers to give a number on the scale. This graph presents a powerful finding, suggesting which groups of people are most represented in program adaptations and which groups of people might not be top of mind when considering EDI and programming. The finding that people of diverse genders and sexualities are considered to a lesser degree in programming is confirmed in other themes, which I will get to soon. I will move now to summarizing what innovative ways programs have adapted to respond to the shifting diversity and needs identified. The most common theme here about promising adaptations that are already happening is that CAPC CPNP projects value partnerships with diverse cultural organizations, and this provides programming for equity-seeking groups. Integrated supports are beneficial for people in crisis and for service navigation. Research participants gave examples of co-programming with Multicultural Center, building a relationship with a local Indigenous agency, partnering with CMHA, taking a mobile food truck to equity-deserving communities, or consulting with an English language class of Syrian mothers to design a CAPC program for them. Notably, most examples were about culture, language, physical and mental health, addictions, and food insecurity. And very few examples were given of partnerships with LGBTQ groups. And a second theme is that to adapt to shifting needs during the pandemic, projects began online programming, drop-offs, and supported families with safe transportation to programming. These adaptations during the pandemic, some went well and some were challenging. For example, projects were considering who has access to technology to join the online programming and how could they reach out to people who might not have this technology access. A third theme that some mentioned is that education and awareness raising about EDI is ongoing. Program staff are listening to people's stories and becoming culturally aware to some research participants. For some, there is training on trauma and parenting, which is especially relevant for newcomer refugee families. And some research participants mentioned there is training on EDI, anti-oppression, and anti-racism that they are taking. A fourth theme that some research participants mentioned is that program spaces consider creating a place that recognizes diversity. This finding was mostly reported by survey respondents. For example, there are toys, books, posters that represent families of diverse ethnicities, abilities, Indigenous, and 2S LGBTQ families in a program space. The program space is wheelchair accessible as another example. And another theme here is that translation and bilingual staff help to improve communication and meet the needs of people with English as their second language. Of course, there were a lot of other practices that were shared, and they included hiring diverse staff and intentionally changing language to be inclusive of equity deserving groups. These 2 points are not big enough in the research to be considered a theme. However, they are noteworthy. So the quote that I have on the screen to the right is an example of this. We were able to successfully support a participant who became pregnant during their transition from female to male. We used inclusive language such as pregnant individual instead of pregnant woman or mom, says a survey respondent, which I think is a really powerful story of considering programming and equity deserving groups. And the last research question we explored is suggestions for how CAPC CPNP projects across Ontario can better practice EDI. The most frequently mentioned theme is to advocate for a change in stagnant funding and/or seek new funding. EDI work, no doubt, requires time and resources when CAPC CPNP projects are stretched thin on both due to stagnant funding. A second theme is to build on the strengths of programs by continue allowing programs to be flexible and responsive. Funding that is constrictive wouldn't work well for projects who are better suited to identify needs and tailor their response in their community. A third theme is to consider who is missing from services and why. A consistent theme throughout the research is that the lowest serviced equity deserving group is people of diverse genders and sexual orientations. And few projects reported adapting programming for this equity deserving group. Further research, reflection, and dialogue is needed to understand why this is and how projects can do better. Another point here is that rural focus group participants identified fewer younger parents are accessing their services, and they're starting to question why that is. A fourth theme is to pursue more EDI training with a focus on equity topics. Survey respondents suggested training CAPC CPNP staff and making more time for learning new EDI related tools. Both the key informants from the EDI early childhood sector working, they strongly suggested anti-racism training. And given the research finding that diversity was conceived as diverse needs and not diverse identities, more training on how people of certain identities are privileged or oppressed would be useful. A broader understanding of diversity would increase awareness of the range of equity deserving groups and the specific attitudinal, historic, social, and environmental disadvantage they face. A smaller theme within the suggestions is to pursue greater evaluation to guide EDI efforts. More evaluation on diversity in the communities that we serve would be helpful for some CAPC CPNP projects. Also, some participants were asking for evaluation on how participants, staff, the board experience EDI across all aspects of their project. Some other suggestions that were mentioned by just a few participants but weren't big enough to be themes on their own is to support with EDI policy development and to provide support with EDI leadership and planning, as well as considering new partnerships to better serve diverse groups. And that is the presentation portion. We're now going to get ready to go into small group discussions, which I'm really excited about. So we'll be going into randomly generated breakout rooms, and we'll be discussing the following questions. What resonated with you, or what surprised you about these research findings? What would you like to learn more about? Maybe there's something perplexing in here. And what do you see as the priority for pursuing EDI in your project and in the network? And we have a designated facilitator, I believe, for each group. So each group will be able to look to one facilitator in the room that has been shoulder tapped. And And this is really a chance for you, if you have not yet participated in this research, to share your voice, tell us what you think. And then we'll be trying to take some notes, and we'll come back into the large group. It'll be about 30 minutes within your small group. And then we'll come to the large group, and we want to hear, what did each group discuss? And we'll be listening to you closely and considering what your thoughts in writing up the final research findings. So you'll have a chance to shape the research findings as well. So just checking in with Sydney, how's it going with creating the breakout rooms?
It's going good. We're close.
Nice.
One little snag is that I have identified 6 facilitators. And so maybe there's somebody who I haven't identified. I've got yourself, Debbie, Kim, Sonalia, Jan, oh, that's you, Janna, Florence, and Ellen. Is
Kim?
there, oh, and Kim, yes,
Kim.
I've got Ellen, Florence, yourself, Debbie, Kim, and Sonalia.
Oh, is Dan here?
Is Dan here? Dan, are you here? Okay. So I could move the people from, I'm not seeing Dan. I could move everybody into 6 rooms.
Yeah, that sounds fine to me.
Okay. So,
and I'll put the questions in the chat as well. And the facilitators should have a Google Doc where they have the questions and they can take notes. Yeah.
Give me one more moment here.
No problem.
See if I can make them relatively equal. Okay, we have, I think, generally 7 or 8 people in each group. And I think there is a facilitator in each group. So shall I make it go, make it happen?
Yes, set for 30 minutes, right?
Yes, I don't know if I set a timer here, do I?
It's in, sorry, it's in the options button of the breakout rooms box. It usually is 30 minutes though.
Oh, here we go, options. Set countdown timer for 30 minutes. No, this is seconds, that's the timer. Oh, here we go. Yes, breakout rooms close automatically after 30 minutes. You want that?
Great, yes.
Okay. All right, here we go.
Thanks, Sydney.
You're welcome. You should be having a